August is my name, and the 1st of August is my birth date.
August, yes, I do remember you from our last head-to-toe assessment. So what brings you in today, August?
So I think I've injured like my shoulder or one of the muscles coming off of it.
Okay.
I was walking the dogs and then they suddenly jolted and my arm like went forward like that. And I also fell over.
Okay.
I managed to catch myself, but I did still hit my head. It's like here.
Over here?
Yeah.
Okay. And when did this happen?
2 days ago.
2 days. And on a scale of 1 to 10, how would you rate your pain today?
Today it's a lot worse. I would say like a 7.
7, okay.
It didn't initially hurt. It's like it's getting worse each day.
And how would you describe the pain right now in your shoulder and in your head?
If I keep really still, I don't really feel too much, but any slight movement, it's like a pulling kind of pain, like the muscles like damaged or something.
I'm so sorry to hear about that. That must have been scary.
Yeah.
Have you tried any over-the-counter medication for the pain?
I took ibuprofen.
Okay.
But that's it. I don't really like to take medication.
Do you remember how many pills you took? How many milligrams?
It was 500 milligrams.
Okay. Yeah. Have you tried any cold packs or ice packs on the shoulder? Okay. Sounds good. So what I'm going to do today is perform a very quick cranial nerve exam to make sure that everything is okay after the fall that you had. And then I'll take a look at your shoulder and examine your shoulder, your neck, and your head.
Okay.
So I'm just going to put on my gloves. I'll take your vital signs first, and then we'll begin the exam.
Okay.
And just quickly checking your mental acuity. Do you know where you are today?
Yeah, I'm in the clinic.
Very good. And do you remember my name from our last examination?
LunaLux.
That's right. Very good. So mental acuity checks out today. Do you feel any tingling sensations in your arms, your neck, your face?
A little bit on this side, like the back of my head here.
Over here?
Yeah.
And how about the rest of your back? Do you feel any pain in your upper back, lower back?
Just on this side, the pain from the shoulder.
Okay, just over here.
Yeah.
Alright. So I'm going to begin by taking your temperature first.
Okay.
You can just close your eyes and relax for me. This is going to go over your forehead, behind your ear. 97.5. Very good, you do not have a fever. Any flu-like symptoms in the last 2 weeks?
No, I just have a little bit of an itchy nose from hay fever.
Oh, okay. It's okay, we all struggle with that. I have allergies myself. Okay. Right, so I'm going to take a listen to your heart. Is it okay if I slide this under your shirt?
Yeah.
Okay. You can just breathe normally for me. Just going to listen to your heart for any murmurs or any abnormalities coming from your ventricular muscles. Clean, clear sound. No signs of any murmurs or abnormal beats. I'm going to listen to your lungs next. Take a deep breath in for me. And Deep breath in and out. Okay, you can just breathe normally now. Okay. No signs of any bronchitis, pneumonia, or infiltrates. Okay. Let's check your levels of oxygenation and your pulse. So please have your index finger. Just relax and take a deep breath in for me. Excellent. 80 beats per minute and about 99% oxygenation, which is very good. Right, I'm also going to check your blood pressure. Is it okay if we do it on this arm, even though it's the one that's hurting you?
Yeah, that's fine.
Okay. You can just slide this in here, and I won't close it too tight. And you can just put your hand under my armpit, and if you could hold this for me. And make sure you uncross your legs and just relax. Okay, 130/60, a little bit elevated. Could be because of the pain that you're feeling, so I'm not too concerned.
Okay.
Alright, August. So I'm going to quickly check all 12 of your cranial nerves right now. Can you look at me and puff out your cheeks for me? Keep them puffed. Don't let me unpuff them. Very good. Raise your eyebrows as high as they go. Don't let me lower them. Very good. Close your eyes. I'm going to attempt to open them. Don't let me do that. Very good. I'm going to try to move your head side to side. Don't let me do that. And on the other side. Very good. I'm going to attempt to push your head back. Don't let me do that. And forward. Don't let me do that. Very good. Now give me a wide smile. Very good. And a frown. Excellent. Open your mouth for me. And can you move your tongue side to side? Can you try to push your tongue through your cheek right here? Very good. And on the other side. Excellent. Right, so far so good. I'm going to check your eyes next. Can you look at the tip of my nose? I'm going to check your pupil response. And from above and across. Very good. Excellent pupil response. Can you cover one of your eyes and try to look at the tip of my nose and count how many fingers I'm holding up?
2, 1, 5, 2.
Excellent. Okay. Switch eyes. Continue looking right here.
1, 2, 5, 1.
Excellent. Now, continuing with checking the cranial nerves that control the movement of your eyes. Can you try to keep your head steady for me and look at the light? Continue keeping your head steady and look at the light. Then my fingers over here. The light again. My fingers. The light. My fingers. Very good. Now continue keeping your head steady and just look at the light and follow it. I'm going to check your eye mobility. eyes are moving together, synchronized movements. Any double vision right here?
No.
How about here?
No.
So no concern whatsoever with the mobility of your eyes. I'm going to do what's called the lid lag test next. Continue keeping your head straight and look right here, and I'm going to drop my light really fast down. Try to follow it. And one more time. Very good. No lid lag noticed. Have you ever noticed any problems with your smell or your taste?
Only when my nose is blocked.
Only when it's blocked, okay. So I'm going to give you something to smell. Let's see if you can identify the smell.
Okay. Rosemary.
That's right, rosemary. Well done. Right, next up I'm going to check the sensations on your face. Can you please tell me if you feel this equally on both sides of your face?
Yeah.
Equally on both sides of your cheeks?
Yeah.
And equally on both sides of your neckline?
Yeah.
Excellent. Right, I'm going to check your ears next and your hearing. Have you noticed any abnormal sound, especially after the fall that you had?
No.
No. Any headaches that come and go and don't go away other than?
Yeah, I get aura migraines.
Migraines, okay. Has it gotten worse since the fall?
I've had one since the fall, and I usually don't get them that often.
Okay. Alright, so I'm going to just palpate your ears really quickly. Do you have any pain right now in your ears?
No.
Okay, continue keeping your eyes closed and tell me if you hear this.
Yeah.
And where do you hear this?
In front.
In front of you. How about this?
Below.
Okay. And can you tell me if you hear this sound clockwise or counterclockwise?
Anti-clockwise.
From your perspective. Very good. And can you tell me if this is getting louder or quieter?
Louder.
How about this one?
Quieter.
Very good. And this one?
About the same. Quieter.
Very good.
Louder.
Excellent. So no concerns whatsoever with the sense of hearing or your ears.
Okay.
Alright, next up, August, I'd like to check your sense of taste. Have you noticed anything out of the ordinary with your taste recently? No. Okay. Any dryness in the mouth?
No.
No. Okay. So can you please stick out your tongue for me? And tell me, what does that taste like?
Salt.
Salty. Very good. Is it okay if I come close and palpate your head?
Yeah.
Alright, you can just keep your eyes closed and relax. And you said that you hurt yourself right about here. Okay. I'll try to avoid that area when I palpate. Is it okay if we remove your ponytail?
Yeah.
Okay, your head is symmetric, no lumps or bumps. Any pain right here at the top of the spine?
No.
Pressing down on your mastoid bone. Any pain here?
A little bit.
A little bit, okay. I have a resident dog in the clinic. So those are the sounds that you may be hearing while your eyes are closed. Right, not noting anything of concern with your head. No lumps or bumps, no abnormal masses. I'm gonna focus on your face and the area that you mentioned that you had your fall on. Not noting any lesions, lumps or bumps where you hit your head. No blues or grayish colors. Your face looks very well perfused. The color of your neck blends well with the color of the skin on your face as well as your scalp. No abnormal discharges from your ear. Normal ear oracle. And let me take a look over on this side as well. Make sure that I'm not missing anything that may indicate a more underlying systemic problem. Okay, I'm going to palpate your jaw next and just feel the bone underneath and your lymph nodes. No lymph node enlargement noted. Not feeling anything abnormal upon palpation. Okay, I'm also going to make sure that your cranial bones are intact. And I'll use here my medical hammer to tap lightly on your face. Let me know if you feel any discomfort. Good. I'm also going to do a quick skin check to make sure that I'm not missing any micro lesions, especially on the side of the face and head that you hit. Continue keeping your eyes closed for me and just relax. I'm just going to check your skin very in depth. Make sure that there are no micro lesions, blue or grayish colors. your head over that way for me. Just going to very thoroughly check the area that you hit. Not noting anything abnormal. And also within your hairline over here. Just making sure that there are no bruises that are hiding under your hairline, which looks very healthy. Most excellent. So I'm not concerned at all with this side of the head that you hit. I'm going to focus on your shoulder next.
Okay.
Alright, August, so I wasn't able to find anything wrong with your head, your face, all 12 of your cranial nerves. I'm going to focus on your neck and your shoulder next.
Okay.
Is it okay if I move the hair out of the way? Alright, let's just... I'm just going to do a visual inspection first. Just take a look at your neck. You can keep your eyes closed and relax. Just breathe normally. Just looking at your skin. Seeing if I can pinpoint any external signs of anything that I may have missed in the previous exam. Normal skin color, no blues or grays, no external signs of any lesions. Okay, I'm going to compare the two shoulders now. They're about the same elevation. So it all looks normal visually. I'm going to just palpate the area. Not feeling any lumps or bumps, no signs of any inflammation. Normal pulse. Pressing down on your scapula in the back. Do you feel any discomfort?
Yeah.
On a scale of 1 to 10?
6.
6, okay. Touching your clavicle in the front. Any pain right here? Okay, clavicle feels intact. head up for me, and then lower back down. Just listening for any clicking sounds. I'm not hearing anything. I'm also going to listen with my stethoscope. Right. And up. Then laterally. And down. And let's repeat one more time. And up, laterally, and down. Okay. I was not able to hear any clicking sounds or no signs of any crepitus, which is very good for your rotator cuff. Very good news. I'm going to do just a more thorough skin inspection of your shoulder as well. Make sure I'm not missing any micro lesions. Checking your scapula in the back as well. No micro lesions or discoloration. From the top of your spine to your shoulder, 9.54. From one shoulder to the other, 19.15. From the top of your head to the shoulder, 16.152. From the top of your head to your neck, 12.15. Measuring your clavicle in the front, 7.152. From the top of your shoulder to your elbow, 14.12. And across your rotator cuff, 8.925. to do some light acupressure next and press on some of the most important points in your shoulder joint and your upper back and release some of the tension. Is this painful?
Yeah.
Okay, I'll be lighter over here. I have here a tuning fork. I'm going to strike it and cause some vibrations, and I'll place it on the bony prominences of your shoulder joint, and you should feel it, but let me know if you don't.
I don't feel it.
You don't? So some loss of sensation over at the tip of your shoulder. Okay, let's try that again. A little bit harder. Do you feel this one now?
I feel it a little bit more, yeah.
That's good. Okay. So it means that the nerves do work, but most likely they were damaged a little bit. Could be from the internal inflammation going on in your rotator cuff. Do you feel this?
Yeah.
How about this one?
Yeah. 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 Yeah.
The vibrations are also healing. They will stimulate the blood flow in the area and direct your energy towards the damaged area over here. Hopefully promote healing. Do you hear this?
Yeah.
Very good. Let's also do a quick skin sensations test over in this area here where you mentioned that you couldn't quite feel the vibrations.
Okay.
Can you tell me if you felt this?
It was very light.
Very light. How about this?
Yeah, I can feel that.
Okay. Can you tell me if that was sharp or dull?
Can you do it again? Sharp, dull, 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 sharp, sharp.
Very good. So I'm not concerned with the nerves in your body. There seems to be no nerve damage from your fall and from the accident that you had with the dogs. I'm going to perform a quick massage and see if I can help you relieve some of the pain. Just going to apply some coconut oil and lubricate the area. Just gonna move your hair out of the way, not to get any oil on it, even though it's very healthy for the hair as well. Okay, August. So I did a very thorough examination of all 12 of your cranial nerves, your head, your neck, your shoulder. I'm not able to find anything that would require you to undergo further treatment. I think you damaged your rotator cuff during the accident that you had with your dogs. It's a mild inflammation that I was able to detect, so it should go away in about a week or so.
Okay.
Make sure to immobilize the arm. Definitely don't work out, don't lift any weights. Try to keep it as immobile as possible.
Okay. Thank you.
Nice seeing you again today.
Thanks so much.